You're still watching the morning show here on the Rise News. Some breaking news. Nigeria has recorded 5 new cases of COVID-19. According to a statement on the official Twitter handle of the NCDC, those new 5 cases bring the total number of the country to 35. Yeah. Lagos, Abuja, we see Edo on that list, meaning that Edo has recorded its first case of the COVID-19. Oyo State has 1, Ekiti 1, Ogun State 2. Federal Capital Territory also has increased number from 4 to 6. Lagos presently has the highest with 24 of those confirmed
24 cases. I mean, I think I was monitoring on a report this morning when the head of CDC in Nigeria did say they were going to update. This was at 8:30. They were going to add more cases, and we've seen it now. So Femi's on standby at the Murtala Mohammed International Airport.
Today, Monday, marks the coming to effect of the ban on international flights by the Nigerian government, and our Rise correspondent Adefemi Akinsoya is now standing by at the Murtala Mohammed Airport in Lagos to bring us up to date on that. Hello, Femi. We can see you live at the airport. Can you just give us a brief of what's happening there? Has the effect come into place?
Morning, Shaitan, Rufai Adesua. Well, the ban has not yet come into place. We're hearing that it will come into place between 11 p.m. and midnight this evening on Monday, the 23rd of March. So naturally, lots of people have crammed into Lagos International Airport, still hoping to get onto their flights. We are standing very close to the Qatar Airways flight that's scheduled to leave around 12 noon local time. We've still got the air hostesses here and people hoping to check in, passengers hoping to check in just behind me there. We've been speaking to as many passengers as we can, and ultimately there is a feeling of uncertainty and panic. A lot of people have made it to the airport here after having to pay for new tickets after their previous tickets were cancelled over the weekend. With a gentleman that we just spoke to who's traveling to Malaysia from Lagos via Doha, Qatar, he says he had planned this trip weeks in advance. It's not a last-minute trip for him. He is absolutely not fleeing because of coronavirus. He is going back to where he's based. But there are people who are definitely rushing out of Nigeria because they feel as though they have more chances of better healthcare, sadly, outside of Nigeria. But when we first pulled up, we were really surprised to see as many people as there were. As I said, there is an air of uncertainty, an air of panic. Lots of people are wanting to find out what's going on. Lots of people have spent so much money. Just behind me again, there is the line for people trying to get to South Africa, and they've had to buy tickets again over the weekends after their initial flights were suspended and cancelled.
Well, Femi, how are the airline operators reacting to this? If you've been able to speak to any of them, because we do know that the NCAA issued this directive over the weekend. Do they have enough time to reschedule these flights and handle what they are seeing now at the airport?
You're absolutely right, Adesua. They did issue this directive over the weekend. We were well aware of this happening before today, but there does seem to be a lapse of communication between airlines and their customers. There are lots of passengers who say they've received messages, but it wasn't clear. They heard notices that their flights may be suspended, may be cancelled, but ultimately there hasn't been enough confirmed information, and that's why you're seeing still so many people at the airport today. One of the ladies we spoke to who might have, I don't know if you were able to see her in the distance, she's also flying on the Qatar Airways flight. This is the 3rd time in 3 days she has had to come to the airport because her flights had been cancelled. She did actually start off flying with Emirates, which we know is different from Qatar. Emirates is the flagship carrier for the United Arab Emirates, and as we know, they're closing their airports to international flights, suspending all flights Emirates have announced. So for her, she was aware of the suspension because Emirates were able to communicate that to her, and she struggled to find other means to get out of the country and onwards to her destination over in London. She's now had to book a new ticket via Qatar Airlines, and she's hoping that she'll be able to check in because naturally she wasn't able to do that with her Emirates flight over the weekend.
All right, Femi, I just really want if we can take the pulse of the people. I can see a lot of people standing around there. I don't know if we could just walk through them, if they'll be willing to speak to us, and so we could just hear their own sides of the story.
Oh, absolutely. Absolutely. Let's have a look and see if there will be anybody willing to talk to us, because as you've seen, there is so much uncertainty. People aren't aware of what they're going to be doing, how they're going to be making it to their destinations. Let's see if there's somebody who'd be willing to speak to us. Excuse me, madam. Are you hoping to? Oh, she does not want to talk to us. Let me see if I can try my luck elsewhere.
I can imagine. I mean, that's just to show the uncertainty going in and around that area.
I mean, this is a very, and I think one of the things that disturbs me about, that live feed is the fact that we can see Femi wearing her gloves and people wearing their masks, but then we still have a large number of people who are just walking around basically acting like they would on a normal day. There's no enough protective gear and all of that. So I'm curious to know what it's the airport, that's almost the hub of COVID-19, because a lot of people are coming in.
But in all fairness, you don't really need to wear your glove,
if you're not sick.
your mask if you're not sick. So I think this is just
family is just being precautious, taking precaution, necessary caution, because she's going to be handing the mics to people. She's
and
going to
the
be
likes,
in close proximity to people, so that's why Femi is wearing that. But if you're not sick, we've been told that you don't need those masks. But let's go back now to the conversation of the day. We'll try and keep up with Femi at the airport and our other reporters on ground covering COVID-19 from every aspect of it. The World Health Organization has said there is as yet no evidence that the spread of coronavirus is reduced in Africa because of the higher temperatures there.
The virus has so far multiplied more slowly in Africa than in Asia or Europe, but about 34 African countries, including Nigeria, has now reported a total of more than 600 cases. Now, health experts have stressed the need to prepare for a significant spike in infections. The head of the Africa Center for Disease Control and Prevention, John Nkengasong, warned that flights and other travel restrictions would help delay the virus, but would ultimately fail to contain it.
As the world continues to mark the Endometriosis Month, health experts are battling hard to curb the spread of the virus while putting research in motion for a permanent solution in the development of a vaccine. Worthy of note is the fact that women, especially pregnant women, are not left out in the pandemic.
Well, joining us now from our Lagos studios to discuss COVID-19 from the perspective of a gynecologist with a compulsory observation of distance from the studio is Dr. Abayomi Ajayi. He's the Chief Executive Officer of the Nordica Fertility Center here in Lagos. He's a member of the Nigerian Medical Association, Society of Obstetrics and Gynecology, American Society for Reproductive Medicine, and a board member in the International Society for In Vitro Fertilization. Thank you so much, Dr. Nos. As you can see, we're observing that social distancing for now. But let me begin with you with the COVID-19. I know you want to talk so much about endometriosis because you are the champion of endometriosis in Nigeria. But last week, the UK recorded its first earliest patient with COVID-19. It was a baby born 2 minutes after testing positive. Days after, Nigeria recorded her youngest patient of COVID-19 as well. It was a 6-week-old baby. But tell me, Dr. Ajayi, how does a newborn contract COVID-19? Is it before birth or during birth or after birth?
Wow, thank you very much for having me, first and foremost. I think we need to understand something about COVID-19, that we cannot beat our chest about it. This virus is just about 3 months old with us. So that's why it's called new coronavirus. We don't know so much about it. And so many things, we're still playing catch up. So actually, the mode of transmission, you see that it keeps changing. Initially, we said it was only older people that needed to be careful about it, but we now know that, for example, in New York, about 50% of the patients that have coronavirus are young people. So it's something that is evolving. So we don't know so many things about it. Just like you said, we've seen 2 newborns now that have had coronavirus, and in Nigeria, we had a 6-week-old baby. But it's difficult to tell at what point was this. Actually, in Qatar, also, they reported a baby, actually 2 cases, where they were born and then they died, and then they saw it was corona. So there's a lot of things that we need to learn about corona now. That's why everybody is saying that what we're sure about is to cut short the transmission of corona by social distancing.
But I also want to look at the care for pregnant women in a time like this. We've not still been able to crack how the newborns got the coronavirus. But how do you care for a pregnant woman in a time like this? A time where you don't even know. Take, for instance, a pregnant woman comes out with coronavirus disease now. Will she still be taken to the isolation centers at the same time be cared for as a pregnant woman? What really happens?
Well, I guess like every other thing, one of the things that we need to start trying to do is to screen and screen and screen. That's why the WHO says the highlights to curb coronavirus is 3 pillars: test, isolate, contact tracing. And I think that also still applies to pregnant women because they are healthy people as well. So unless we follow these 3 pillars as well, to be able to get the people who really are infected and the ones that are not infected, then it might just be something very difficult for us to do.
Okay, so I mean, we've spoken about COVID-19, but then I want to talk about, endometriosis, of course. Now, this month is the month of endometriosis, and I want to know what you are doing to create awareness, because we do know that what is making the headlines now is the coronavirus. But how are you steering the conversation to endometriosis to let pregnant women realize what they need to do to get tested in time? We have a break coming up very shortly, but you can begin to answer.
Okay, well, endometriosis, March is a World Endometriosis Month, but of course, we are part of the world community, and we know that what is happening now is COVID-19. So we have to sort of adopt or adapt to what the present situation. Ordinarily, we should be doing some matching. We do an annual march for endometriosis, which most of the time ends up in a carnival, but of course, because of social distancing, we cannot do that this year. So majority of the things that we're going to be doing on the 28th of March will be online. So we're going to get sufferers, experts from different parts of the world to have a conversation, a live chat on the 28th of March. So that's essentially what we're going to be. Though there's a bigger thing that we're planning for May, where we're launching the African Endometriosis Society, where we're bringing people from different parts of Africa to hopefully, I'm sure maybe by then this coronavirus thing will have settled down, and then we'll be able to, but if not, then we might have to shift the date because we need to be healthy first and we need to be alive before we can do anything. So that's what we're looking at in May, on May 15th, for us to bring people from all over Africa together. And then the president of the European League of Endometriosis has agreed to be part of that program. And so we are looking at how we can have this handshake of all the people who are talking about endometriosis in Africa, because the awareness of endometriosis in Africa is still very low. Yes, probably good in some countries, but overall it's still very low. I still went there for a conference where somebody was telling me that endometriosis is a disease of the whites, And so we need to talk more about endometriosis, especially to the caregivers, the doctors, the nurses, and all the people who are looking after them, and probably even psychologists, because we know some of these patients might need psychological support. So it's a conversation that needs to go on and on and on and on. So I think we'll keep ourselves busy this year as well, though most of the things might be initially online. But hopefully we'll be able to do some live things as time goes on.
Indeed. But Dr. Ajayi, you have always championed the conversations about endometriosis in Nigeria in particular and in Africa. I was going to ask you about that level of awareness. You've said it's low, it's still very low. In Nigeria, how low is it? And can you use this opportunity to just briefly explain to people what really is endometriosis? And as well as, is there any reprieve for sufferers at this time after many years of this conversation?
Well, I would say that with endometriosis, the situation is that today is better than yesterday, in the sense that a few years, I think about 12 years ago, when we started this conversation, people could not even pronounce the word endometriosis. But now it's easier for, even our doctors are making more diagnoses. It was then, somebody is discussing a case with you, and they've started anti-tuberculosis drug, they've started all kinds. And then he says, don't you think that's endometriosis? That's reduced drastically now. So I think the awareness is better, but the only space where there is room for is this room of improvement. So I think we can still improve more on this. And then also it might be unfair. Maybe we're looking at only at the major cities. What about the interland? So this conversation needs to continue to go on. And for the sufferers, I think also there are so many things that have happened since we started about 12 years ago. Now endoscopic surgery is getting more popular. Endoscopic surgery is pinhole surgery, you know, where you can go into the abdomen without cutting into the abdomen. Is getting more popular even in Nigeria. And so many things are happening, and then even the drugs are becoming more available, you know. So I think the most important thing is, just when we were training, we used to say that if you can't think of it, you cannot see it, you know. So people are thinking more of endometriosis, and therefore they're saying more of it. So I think it's getting better, but of course it can only get much, much, much better.
Real quickly, I want you to explain what it is, endometriosis, to a very lay person. You see, because there are a lot of people that are watching us now, they don't even know what it is. They want to have proper understanding of what it is. So to the market woman, explain endometriosis to the market woman. And let's also talk about affordability of care. Sir, what is it? What is endometriosis?
Well, thank you so much. I think that's $1 million question. Now, endometriosis, it's, I think it has so many A-locks. From the name, you cannot pronounce, but endometriosis is the occurrence of the inner lining of the uterus, you know, or the womb. Because now, we know that a woman has a womb, all right? Where she sheds every month, because she bleeds every month, or she's supposed to bleed every month. Where she shed, that part of the uterus that is shed every month, we call it the endometrium, all right? So this endometriosis is when these tissues like the endometrium occur in other places apart from the inner lining of the uterus, all right? What this means is that every month when this woman bleeds, she also bleeds in these abnormal sites. So in the commonest place where this endometrium can be is on the ovary, all right? So what it means is that she's bleeding from the ovary every month. Unlike a normal menstrual period, which comes out from through the cervix to the vagina, and then we can see, that's why you can use a sanitary towel. This one stays in the abdomen. And that is why, over time, because blood is now in the abdomen, so it's like bleeding inside the abdomen every month when she bleeds. Over time, we have what we call scar formation, you know. The organs now start gumming together. So the intestine and all the organs inside, which normally move on each other, they just rub each other around. Now they become glued together. And that is why the commonest symptom of endometriosis is pain. Now, this pain could be with the menses, all right? So every month she's menstruating, she has so much pain. Now, what we try to do is, not everybody who has very painful menses that has endometriosis, but that is one thing that makes you to suspect. This is what I mean. Many women will bleed, normally they have their menses. Nobody knows, unless they tell you. You are sitting next to a woman who is menstruating, you don't know. But with people with endometriosis, the whole world comes to a halt, okay? For them to even get out of the house, if they must get out, they are on very strong analgesics, you know, in order for them to be able to just go through the chores, daily chores. So the pain is so intense, and this tends to affect every aspect of their life. Because this pain also could, apart from menstrual pain, it could just be there. You just have your lower abdominal pain that is never going. For some, it's when they want to urinate that this pain comes on. Or some, when they want to defecate, this pain comes on. And for some, it's when they have intercourse. This pain is very intense. So it even prevents them from wanting to have intercourse. So you see some women give all the excuses in the world in order to not to have intercourse. And some husbands don't understand. So it's also a source of marital disharmony because some husbands say, oh no, she's having an affair, that's why she doesn't want to have sex with me. But the problem is that this sex is painful to this woman. So she's not even having sex with anybody, you know. So apart from pain, the other thing that they might have is bleeding. This bleeding might be just a normal menstrual bleeding, but it's heavier than usual. Or it occurs irregularly, so they cannot even time when they're going to bleed. So you can imagine you're going for a dinner, you're going for anything, and you're putting on white as a woman, and then suddenly you start bleeding. So this tends to take off part of their lives as well.
Let's just say this now, because Shaita is going to come in and ask another question. So pretty much, let me get it in lay terms. Pretty much looks like the woman with the issue of blood, pretty much.
That was the first record of endometriosis. That was in the Bible. The woman with the issue of blood. It sounds so much like endometriosis. Because even the Bible says she had been to so many physicians. And that is the typical story of a woman with endometriosis. They will have been to so many physicians who won't know what is wrong with them. So there is always delay in diagnosis as well. In advanced countries, like the UK, they say there is a 4 to 10 years delay in diagnosis. In Nigeria, we don't even know. Because when we're talking about women in the villages and who don't even have any access to maybe a gynecologist, all they have access to is a nurse or whatever, it might never get diagnosed. So those are some of the issues with endometriosis. And finally, also, infertility is also common in people with endometriosis. Now, about 30 to 50% of people with endometriosis.
We only have 2 minutes to go, and I would like to bring it back to COVID-19. Now, we know that the virus goes for, is people that have a shorter immune system have the possibility of catching this virus. Now, I want to ask if endometriosis has any effect on the immune system, making people that have it more susceptible to COVID-19.
Well, before you draw any allusions about COVID-19, I warned you that it's a new virus, so we don't know so much about it. But one thing that might be related is that we know that the immune system might be involved with people who have endometriosis, you know. So, but I don't know anything about whether the two of them are in any way or form related.
Let me ask you, because you're also a gynecologist and an obstetrics. Let's talk about the immune of the babies. Prior to COVID-19,
I'm not a pediatrician. I can't talk about babies.
How do they fare? I think that's the biggest question now. How do these babies fare in this period of COVID-19? Should they come down affected, like the 6-week-old we have in Nigeria?
I am careful to talk about only things that I know I'm sure about. So I'm not a pediatrician, so I might not be able to talk about babies.
Let's quickly look at this. I want to talk about cost of treating endometriosis now. How can we get the cost down low in the society? Because it's quite very expensive, you know, to treat it.
Well, sometimes I'm surprised at some of these questions about cost. And this is what I mean. Right now, Nigeria does not even have enough facilities. That's what we should be looking at doing. We need facilities to start with. Because I think it's putting the cart before the horse. When we're talking about the cost now, what we should all be concerned about is how do we have facilities? That's what COVID-19 is showing us now, that we don't have medical facilities. So I seriously don't know anything about, because if somebody has opened his own hospital and he has taken a loan from the bank, I'm not in control of how much he charges. So if the government is helping people to set up so many things, for example, now the CBN has come out with this RSSF to involve hospitals. I'm sure with that, the health facilities in Nigeria will get better. So for me, seriously, it's difficult for me to talk about the cost, because it varies from one center to another.
If you can, in 20 seconds, Dr. Ajayi, what's the message for this month's endometriosis awareness? I think that we've lost connection there, but Dr. Ajayi, if you can hear me, what's the message for endometriosis this month?
Everybody, people who are the sufferers from endometriosis need to know that they are not alone. There is help even in Nigeria. Nigerian doctors are making more diagnoses, and there are more facilities coming up for treatment, and we only think it can only get better. So this month of March, which is Endometriosis Awareness Month, the watchword is that just hang on there, and we'll be able to, help is on the way. Thank you so much.
On the way. Thank you so much, Dr. Ajayi, for coming on the morning show today.